Well, good day to you. This is Greg Downing with Texas Medicare Advisors here in beautiful Austin, Texas. And today I wanted to make a short video that explains to you exactly what your Medicare Part A covers, your Medicare Part B covers, and what those costs are, and why it is so important to have a Medicare supplement plan. All right, so let's look right here and start with exactly what is your Medicare Part A and how much does it cost. The beautiful thing is, it doesn't cost you anything. You worked your whole life for it. Now, that's your hospitalization coverage, and while it is very good, you are responsible for a lot of deductibles and out-of-pocket costs. For instance, when you get admitted to the hospital, you have to pay $1,408 each time you're admitted. And if you're in there for an extended period of time, you end up with copays up to $682 a day. And that's not something we want to have happen. And God forbid you're in there over 150 days, you don't even have any coverage. You have to pay for it all. We don't want that. That's why we get a Medicare supplement plan or Medicare gap plan. Same thing, two names to pay for those. All right, and for some reason, I have no idea, but the government wants you to pay for your first 3 pints of blood. And about $500 per pint, that gets costly. We don't want you to have to do that. That's why we get a Medicare supplement plan that pays for that. Same thing if you got a skilled nursing facility, if you've got some rehab you need to do, as long as you're in there less for 20 days, you're in good shape. But after that, you got copays. We don't want that. All right. Now, your Medicare Part B is in boy. That is going to cost you money, and you have to sign up for it. That costs $144.60 for the average person. Now, if you're a high-income earner, that's going to be more, and we need to talk about that. But let's just assume you're not. Now, that is for physician services. Also medical equipment, ambulance rides, and basically the way your Part B works, the government pays 80% of everything, you pay 20%, which sounds good unless you get a $50,000 bill. Then you're stuck with that. We don't want that. What we want is a Medicare supplement plan that's going to pay the 20%, so you're not out that. Now, the only thing that you are going to be responsible for, and remember this number, is that the Part B has a deductible. That's $198 a year, all right? So you're going to be responsible for that. That's the only thing your supplement's not going to cover, and that's for the whole year, all right? Okay, so that's your Medicare Parts A and B. Now let's talk a little bit about your supplement options or Medigap options. Okay, now this is the chart that comes out of your Medicare Gap shopping guide from CMS. All right, so as you know, Medicare's been around a long time, so there's been lots of Medicare supplement plans that start from A and they go all the way to N. Well, guess what? A lot of them don't exist or they don't apply to you. Today, in 2020, the best Medicare supplement plan you can get is a Plan G. A Plan G. Now, if you look, let's just see if we can, at these things over here, which we've already talked about, your deductibles, your co-insurance. Well, if you look at Plan G, there's check marks all the way down. Only thing that's not checked is the Medicare Part B deductible. That's at $198 you're going to be responsible for. But other than that, it covers everything. Actually even gives you some foreign travel. If you're traveling out of the country, it provides coverage as well. All right, so this is, I know, a little complicated to read, but here's what I did for you. All right, so let's say you want to go with a Plan G. This happens to be a female, 65, here in Austin, Texas, non-tobacco user. I quoted for popular carriers, Aetna, Mutual, Omaha, Blue Cross. Now, as you can see, Plan G, they are different cost. Now, why is that? Is it different type coverage? No, these plans are exactly the same. There's no difference except for how much an insurance company charges you and their service. All right, so why would you want to pay more for something if it's the exact same? What we want to do is choose a plan that's an A-rated company that's got the best deal, and over time we can always shop it and save money if we need to move later on down the road. Okay, so what I did for you, and you should have this piece of paper, I should have emailed it to you as an attachment, is if you come down here to cost, what I'm trying to do is help you get an idea of what your costs are going to be moving to Medicare. Remember, Part A doesn't cost anything. Part B $144. Medicare supplement, you get one of the lower costs, $98. Medicare Part B D, as in dog, that's your drug plan. Now there's 30 of those to choose from, but a good plan is only going to cost around $21. All right. So you add that plan in to that. So this is your total cost to move to Medicare. So every month, that's what your cost is going to be, other than copays for drugs and that deductible of $198. I hope this was helpful. And one other thing, you'll do notice here that I did quote Plan N. If you want to save some money, you can see it's about $20 less a month. Plan N is exactly the same as Plan G. The only difference is right here on these asterisks is that you have $20 copays every time you go see the doctor and a $50 copay if you go to the emergency room. And so that may be an option there for you to save some money. We can talk more about that later. All right, so that's basic information. Study this. Let's get together soon, get you signed up for a plan, and make it happen, Cap'n. All right, have a blessed day. Greg Downing from Austin, Texas. We'll talk to you soon.